As the clock strikes 7, the vibes are alive. Inner circles here, where voices thrive. Turn on your screens, let the magic unfold. Listening and healing as stories are told. Come on, come on, this is your time. No topics too tough, just heed the call. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all, let's lift every voice. Inner Circle podcast where hearts unite. Sharing our truths, bringing hope to the light. Community strong, we're never alone. Together as one, we've created a home. With laughter and love, we break down the walls. No topics too tough, just heed the call. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all.
Good evening, everyone, and welcome to the Inner Circle podcast, where we amplify, empower, and elevate immigrant voices. Tonight, we are honored to be joined by Carolyn Woahloe. I hope I'm pronouncing your name right. Obviously, you can, correct me, catch me up on that. But a nurse practitioner and founder of CaroMas Health Services. Carolyn journey as an immigrant to entrepreneur is a very powerful story of resilience, compassion, and purpose. She's building a clinic, not only provides care, but also breaks barriers and builds trust in our community. So tonight we'll dive into her story, her vision, and the difference she's making through healthcare. So Carolyn, welcome to the show. Welcome to the Inner Circle podcast. We are so excited to have you.
Thank you. Thank you for having me. It is an honor to be here tonight. Thank you for reaching out and giving me the opportunity to talk to all of us tonight, my Liberian community, my non-Liberian community, everyone out there in the social media world. Thank you for joining. I hope you can get one or two things out of this conversation tonight. So it's an honor to be here. Thank you.
Okay. That's great. That's great. Folks, there's the Inner Circle podcast. You can follow us on Facebook. Subscribe to our to our Facebook channel. Subscribe to our YouTube channel. We are on X, Spotify, Apple Podcasts, LinkedIn, wherever you get your podcast. So thank you so much for joining us. And you can contribute to the conversation tonight, as some of you have already started doing by putting a comment in the chat. Calling our number 952-594-5154. So Caroline, man, tell us a little bit about yourself, a little bit about your journey from LIB all the way to the DFW to the Lone Star State and where you are right now.
Well, like I said earlier, my name is Carolyn, Mrs. Carolyn Woahloe. And I am married to the wonderful Thomas Woahloe. And that's how we came up with CaroMas. So it's Carolyn and Thomas. And there you go, you have CaroMas. I started as a nursing assistant. First, I came to this country when right after April 6th, the last war. That was the last war I experienced in Liberia. I'm born to Mrs. Ophelia Banama, and she's Nibadian, and my father is from Grand Cape County, but I was born and raised in Nimba. So everything that I know growing up is all the Gil culture and tradition. So I love that. And almost all my family, 90% of them live in Minnesota.
Oh, wow. Okay.
Minnesota is like my second home. I actually migrated to the US in early 97. And I went to high school in Minnesota, Champlain Park High School.
Oh, wow.
Yes. And then I did 1 year of college at St. Cloud State University. And then after that, my dad, who lives here in Bedford, Texas, he's like, don't you want to come to Texas and see if you like it? So I was like, okay. So since 2001, I've been in Texas and I love it. So
Okay. Okay.
yeah, so all of my university education, I got it in Texas here. Like I said, initially I wanted to be a medical doctor. That's what
Mm,
I've always wanted to be. Growing up, seeing my mom, who used to be a nurse, a midwife, back home in Liberia. Our two-bedroom apartment, one was the clinic, and the other one was the bedroom that everybody and anybody that could fit,
yeah.
left in. So that's where my passion came from, to become a nurse or doctor so I can take care of people. And that passion has always lived with me.
Mm,
Um, I started my nursing journey in 2003. I started as a nursing assistant.
mm,
Then
that's,
2006, I went to LVN, licensed vocational nurse. Then 2009, the registered nursing. 2012, Bachelor of Nursing. In 2022, I got my master's in nursing, and I'm
wow.
not stopping.
Okay, okay, man, that's an inspiring story. I mean, obviously, I bet it, right? You got your passion from your mom, growing up seeing your mom in healthcare. I think that's what led you, right? As you stated, right? I mean, it's like that's what kind of inspire you to. Is it, I'm going to follow my mom footsteps.
Hmm. Hmm.
Okay, 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 that's good.
And
What
I
else?
have four biological children and two adopted. So altogether, my husband and I, we have six children, and we've been married for 15 years. So
You have 6 kids. What time do you have? What's the time do you have for all those education, right? It's like up to, I mean, you got like masters in what in nursing. What time do you have? All of those education.
well, that's why I'm here to tell that sister, that brother,
Mm,
especially coming from Liberia,
mhm,
that I didn't even know how to speak English. I've said this so many times. I started learning how to speak English at the age of 10. And
mm,
I sat down in class in America, then raised my hand up in the classroom because I could not get my words out and I felt so limited. All I wanted to do was get a 4.0
mm,
and and be the best I could be when it comes to education. But don't ask me to speak because I couldn't, express myself. And so that right there, if I can do it, so you can do it. There is no excuse about you not being able to do some of the things that the opportunity in this country is so many. And then, of
mhm,
course, not forgetting my king. I call him my king, my husband,
yeah.
who
Okay.
has been nothing but a support system, like above and beyond. One of my friend, Orita, she always say, Thomas, his name is Thomas. He said Thomas got his degree in how to make Carolyn look good.
That's good. That's good. That's good.
So my
Well, I mean,
husband, yes. So yeah,
well,
he's been a great support system. And I also started a Liberian nursing organization
mm,
11 years ago called the Liberian Nurses Association, where
okay.
we work in Liberia. We take medical mission trip. We work with undeserved healthcare facilities in Liberia.
Okay.
And it's just amazing. So you can do it. If I can do it, you can do it. It's all about the mindset and telling yourself, yes, I can.
Okay, okay. I mean, as an immigrant, obviously you have, outlined some of your, talk about some of your stories about coming here, your journey as an immigrant, especially healthcare, right? Is like, what obstacles I can say have you faced, right? In your journey, I mean, your educational journey, and now even, being an entrepreneur. What are the obstacles have you faced?
Well, obstacles, I mean, being black,
Mm,
being African,
okay,
and having an accent and being a
mm,
female, that right
okay,
there, those are like that's like no. Before I even started my nursing journey, I
mhm,
told myself I started in in a class in high school. That was one of my elective I had to take.
okay,
Um, was medical terminology,
okay,
and I couldn't pronounce some of those medical words. And I told myself, there's no way I'm going to do nursing because I would not, no one's going to be able to understand me. So I left nursing, I left my dream, I left my goal, my vision, everything, and went and did business information system.
Okay.
That's one of the reasons why I moved to Texas, because University of North Texas was the university that was offering that degree. So I
Okay.
went to UNT, I got my business information degree. After a year, I said, this is not for me. And I went back to and started CNA. So
Okay.
some of the challenges that I have faced, for, you know, sometimes when you go to the workplace
Mm-hmm.
and some people hear your accent, they don't want to give you a certain position.
Mm.
But I have, to God be the glory, I have worked as a assistant director of nursing here in
Wow.
Texas.
Okay. Okay.
So I've worked in a manager position before. I became a nursing supervisor at one of the biggest hospital here in Texas. I
Mm-hmm.
did, once I realized who I am,
Yeah.
and I realized the power that I carry, and
Yeah.
the skills and the experience and the wisdom that I carry.
Yeah.
um and I discover myself. When I
Mm.
discover myself, that's the word. When I discover myself, and I have a couple of people tell me, oh, you are so beautiful, I love your accent. I'm like, if people can tell me that I look beautiful and they love my accent,
Mm-hmm.
then I need to love me,
Yeah.
and I
Yeah.
need to accept me for who I am, and I
Yeah.
need to accept my accent because this is my identity as a
Yeah.
Liberian.
Wow.
I've been here almost 30 years, and people are, oh, you still know how to speak Kolokwa. I'm like, yeah, that's me. That's who I
Yeah.
am.
Yeah.
When
Yeah.
you have that self discovery, you identify who you are.
Mm-hmm.
Nothing, absolutely nothing will derail you from reaching your goal and fulfilling your purpose. So I really haven't had much of a challenge in my field, and also, that is also because that's my passion. And I
Mm.
do it with everything I have. If
Okay.
you take nursing away from me, I don't know, apart from loving my husband and taking care of my children and being a knucklehead and giving Dr. Orita a headache, I don't know. But
Wow. Wow.
nursing is my passion. So
Yeah.
I don't allow the disadvantages and the limitation to get
Mm-hmm.
in the way of the
Okay.
things that I need to do for my patients.
Yeah.
So that right there, it has helped me. Of course, I'm a Jesus Christ girl.
Yeah.
God is in front of everything that I do, and the peace that I found within my work,
Yeah.
it just makes everything come alive.
Man, that's an inspiring immigrant story right there, right? You have not allowed your accent to hold you back. You have not allowed any kind of a limitation or what people think of you to hold you back. So I think that's inspiring. I think every immigrant listening to you tonight, every person listening to you tonight should kind of, take away, from that story. But folks, tonight we are discussing immigrant voices in healthcare, caring for our community, our way, and we have Carolyn Woahloe with us in studio. And man, I'm already inspired by her story. But when you look back, though, what has been like a dream come true for you, right? I mean, what's the moment that you said, "Hey, you know what, there's a dream come true for me? What moment can you look back on, right? Over your long journey.
I married Thomas Waller.
Oh, that's a dream moment. Okay, man, it's like I'm glad that it's like I'm glad like you're giving your husband the props. That's it's like I'm inspired by that. You know what I mean? Things like that is necessary because sometimes you don't have a lot of females now community don't do that, but the fact that you're doing that, giving him his props, I mean that's really inspiring.
Yeah, yeah,
So
he
go ahead.
deserved it. He
Mm,
deserved it because once upon a time, I didn't believe in myself. I
mm,
didn't think that I could do it. And, I met him in my at a time in my life where I thought everything was over.
mhm.
And he brought back the true me. You
Okay.
know,
Mhm,
he brought back what I've always wanted, to
mm,
have.
mhm,
And the reason why I'm saying that, because he supports my dreams,
mhm,
my passion.
mhm,
This is the person that took me back to Liberia after so many years. And when I
mm,
came back, I told him, the condition of these patients that I saw at one of the healthcare facilities in Liberia, I didn't like it. I want to start either a foundation or an organization, and he support me. I was just trying to be complacent with my education. When we first met, I was just a 2 years degree holder in nursing. And
Yeah.
he kept telling me, are you going to sit here and allow your science courses to expire? Because, when you do the
Yeah.
AAP, the microbiology, everything, you have up to 5 years. So
Okay.
either, continue your education. And he literally went and registered me to finish my bachelor's degree in nursing. And he told me
Okay.
I'm not going to stop. I
Okay.
was I was pregnant with our first child when I finished my bachelor's degree. Then come to my master's. He's like, so you're just gonna, stay there and just stay with bachelor degree? Aren't you gonna go? Mind you, this man is almost a PhD holder. Like
Yeah.
we both just push each other. When we both met, we both have associate degree. Now we are all
Wow.
master degree holder and going higher to get,
Wow.
the PhD and the doctor. So that's one big accomplishment for me, my children, of course. And then
Mhm.
when it comes to the professional aspect of it, it's opening our own practice. The fact that he
Mm.
believed in me,
Yeah.
my husband was like, okay, you've worked, you have the experience, you want to open your own practice, I'm going to support you to do that. And
Wow.
it's been a little over a year since we opened CaroMas Healthcare Services. I'm the only provider at CaroMas Healthcare Services, and he allowed me to be me. He allowed me
Yeah.
to shine. He allowed me to just do what I need to do, because his motto is, when my wife is good, when she's happy, when she shine, that is
Mm.
me that's shining, because she carries my last name.
Mhm.
So if my
Wow.
wife succeed, I'm succeeding. My children are succeeding because my wife is succeeding.
Yeah.
So his job is to make sure I succeed, and my job is to also be that helpmate to him to make sure that he succeeds. So the support system is everything, and I'm saying all of this out of the I'm boasting in the Lord. The
Yeah.
good
Yeah.
thing, we both are into the things of God. He's a minister, he's an ordained pastor also,
Okay.
but he
Mhm.
also has he has a degree in healthcare administration, and
Okay.
he did public health epidemiologist. That's what he did.
Mm.
So we just trusting God, serving God, and doing what we can do to bless humanity and serve God and be a blessing to humanity.
Man,
So
like in my little brain voice, I was say two of you love book or two of you love book business by way. That's good, right? That's a compatibility. I think that's a compatibility there, right? Two of you, right? Two people who love education. I mean, there's some. I mean, there's definitely. I mean, there should be compatibility there. But I mean, Thomas, man, you are the MVP tonight. Your wife is giving you props. She's giving you all the praises. So I mean, keep doing what you're doing, and I think you can be an inspiration to a lot of to a lot of men out there. But first of all, I think Dr. Rita is asking here whether your husband have a brother. Maybe she want to join our family. She want to join our family, because what kind of woman would not want to join that kind of family, right? It's like, so Thomas, Dr. Rita want to know, do you have a brother? But go ahead.
Dr. Dr. Orita she's a doctor of nursing, and she's married to a doctor. She's already married
Okay,
with children.
okay, okay.
But
Maybe
yes,
she's
someone
speaking. Maybe she's speaking for the lady. I mean, for the other ladies out there, right? Ladies that are still
exactly.
looking. Yeah, that's
He
what I
he
mean.
has he has one brother that is still married, that is still single. So
Okay,
and he lives in Minnesota. Ladies, if you are listening, I have
okay,
my brother-in-law, that the
okay.
last brother of
Mm,
Thomas.
mhm,
He's he has four brothers. So his mom have five boys, all boys,
mhm.
no girls.
Wow. Okay, okay.
Yeah. So so
So
yeah, he
ladies, you are
deserves it.
listening, right? Thomas has a little brother here in the greatest state in the union, in Minnesota. The man live in Minnesota and he's still single. So I mean, go figure. You know, yeah, yeah. But
He not let trouble.
okay, that's good. That's good. That's good. That's good to hear. That's good. It's good that he doesn't love trouble though. But
Mm,
the other thing though, right? How does your immigrant background or Liberian and then now you're a provider? How does that, how does it kind of position you to care for your patients? You know what I mean? Things like that.
One of the reasons why we started CaroMas Healthcare Services, first of all, our mission is providing really compassionate,
Oh
high
wow.
quality care,
Okay. Okay.
making sure that healthcare is available and accessible to our community. Even though sometimes we all come out here, like you have this podcast, right? This platform, they're
Mhm.
educating people and stuff.
Yeah.
Most of
Yeah.
our people don't lean towards these kind of positive things, right?
Sure. Yeah. Yeah.
So I'm like, I'm gonna start something. It's scary, but
Mm-hmm.
I'm gonna start it anyway because I know and I believe our community needs this.
Wow.
If you look at the statistics,
Mm-hmm.
it says most time the reason why our community don't seek medical care is either it could be cultural barriers,
Yeah.
it could be traditional, it
Mm-hmm.
could be spiritual, it could be they don't have access to healthcare,
Yeah.
or they do have access to healthcare, but they don't understand half of the things that happen when they go seek primary care,
Okay.
or they are not asking the right question when they go see their doctor.
Okay.
There's a stigma that comes with that. Most people, most of our immigrant community, they are afraid it could be immigration issue. So
Yeah.
they don't want to get into the wrong doctor office and then they end up calling, finding out certain things about them. And before
Yeah.
you know it, the law enforcement is at their door. So
Okay.
these are all of the barriers and the stigma and things that happen. A lot of our people in the community don't want to seek medical care. And
Wow.
sometimes they don't, some of them too, they don't want to know what's going on with them.
Mm-hmm. Mm-hmm.
So this was one of the driving force behind me opening my own practice where I can relate to my community and
Mm-hmm.
say, I'm here. Even if you go see another doctor and you have your lab results with you, the doctor gave you medications that they didn't have time to explain to you
Yeah.
why you're taking this medication, how long you're going to be on this medication, what are the side effects. You can always call me. I'm available. I may not be available right away, but once you call me and tell me I have a question, I will make time to speak with you regarding your lab results. You come to the place, we will sit down and go through everything with you, what your AST is, what your ALT is. Those are all liver enzymes that you need to be aware of, you
Okay.
know. And
Okay.
a lot of people don't know that. And I see this in my practice when I see our people, they come like, oh my goodness, my other doctor didn't explain this to me like this.
Mm.
So just try to build that trust in our
Yeah.
community to say one of your daughter is here and she is
Wow.
willing to take care of you. It's not free,
Yeah.
but it's accessible and it's affordable.
Okay. Okay.
So we
Wha-
take different types of insurance also, and if you don't have insurance, we also cater to people that don't have insurance.
Wow. Wow. That's good. That's good. How has been the community reception though, right, in the DFW area since you established your clinic? You said over a year now. How has the community received you?
I've been very vocal and involved in my community, and I would give it to my community. My DFW people have been very, very supportive. A lot of them would share my flyers on Facebook. They would
Mhm.
call me and come to the clinic. They would call and schedule an appointment, even though some of them don't want to come back for the follow up.
Yeah. Yeah.
But it has been a great experience, a great journey.
Mm.
Our community president, he's very, very supportive. And I have a lot of my age group people that come to the clinic and they'll be like, okay, Carolyn, I know, I have a doctor, but I want to switch my doctor. I want you to be my doctor. And
Okay.
some of them still have that question, is she going to be very confidential with my information? Those are some of the things that stop some of our people to come to see me or see people, of their own community. So, and for me in the DFW, like I said, I've been very involved. Don't forget, I'm also, our term ends this year, but I've been the assistant board chair for our community.
Mm.
Uh,
Okay.
for 3 years now. So very, very involved in the community. So when I call or when I'm doing something, that, if not 100%, I mean 100% won't show up, but at least 50, 60% show up. And I started right here in my living room, doing telehealth, medical weight
Okay.
loss.
Okay.
And so that right there, they were really, really supportive. Some of I call them the VIP patients because they were the first to come and see me, even when I didn't know what I was doing.
Yeah.
When I still had questions, I'm like, am I doing this right? They trusted me with their
Mhm.
care. So I'm very, very grateful. So yes, the DFW community, the Liberian community has been really, really supportive. So I'm glad.
That's good. I'm glad you brought up the issue of trust. Healthcare is a very delicate issue. There are a lot of complications there. It's a lot of people don't even seek, preventive care or even healthcare as a whole.
Mhm.
And then in our community, right, there's an issue of trust. I mean, as you mentioned earlier, someone walking through your door, the first thing is she going to put my business out there? Is she going to tell her friends? Is she going to put it on social media? How do you assure your patients that, look, man, if you walk through CaroMas Health, your data, your information, your care is safe with me?
So when you walk, before you even think of CaroMas, what makes us different? What makes us different is we see the whole you, right?
Mm-hmm.
And we create that space where there's safety first, because I have an oath that I have to abide by. I
Yeah.
took an oath to take care of people. And that's why most time in the healthcare field, they say don't take care of your family, because don't take care of your husband, your children, because of that you don't want to cross that boundary, right?
Mm-hmm.
So when you walk in CaroMas Healthcare Services, I tell my patients what you discuss with me is between me, you, and God.
Yeah.
If you want to go on Google or whatever platform to say, oh, Carolyn is my doctor, Carolyn is my nurse practitioner, my provider, whatever, that's you. You have the right to do that. But
Mm-hmm.
as far as your medical information, first of all, we have the privacy consent that you sign that to tell you that, yes, everything here is private. If you want to tell people, I see Carolyn, go and see her, that's fine. But your information is not going to get out of here. It's in the book and it's HIPAA compliant.
Okay.
Yes. So everything we do is all professional. There's nothing, no one is going to come today to say, oh, Carolyn, I saw Carolyn and she said this about me and that. No, 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 no. Because when it comes to professionalism, that's number one for me. Number
Okay.
two, safety, professionalism, and that right there, you can rest assured. That's it. That's the
Okay.
key point right there.
Okay.
Professionalism and safety. Mhm.
Okay. Many healthcare professionals, right, like nurses, right, they rather stay within a hospital system, right, rather than going on their own, right, establishing their own business or their own clinic. What made you to take that leap? What made you to say, you know what, I'm tired of working for other people. I need to do this thing on my own. What made you to take that leap?
Wow, so thank you. So one of and you won't believe that one of the main reason why I
Hmm.
decided to start my own clinic was
Yeah.
my husband and I, we run this organization. And every time we have to be asking for excuse, put in your request to be off so you can go answer the call.
Mm-hmm.
Go to Liberia for medical
Mm-hmm.
mission. You have to work around other people's schedule.
Mm-hmm.
And sometimes they won't give us the time off that we need to go and do the work that we want to do.
Okay.
Apart from just doing medical mission, we are also into ministry back home. So we have churches that we support, that we go and do work at, and all of that. So when I got my nurse practitioner, my friend, at that time I was working as a nurse on the road, doing travel nursing.
Private nurse. Okay.
Uh-huh. And then Dr. Oretha, she's like, you need to quit and go and get your experience as a nurse practitioner. I'm like, girl, they don't pay me much. They're not going to pay me this much money that I'm making now on being a registered nurse. She's
Mm-hmm.
like, it don't matter. You need the experience. The experience is everything. So
Okay.
I had to stop my travel nursing, come back home, and start as a mid-level nurse practitioner.
Okay.
And what really got me my old boss when I did my preceptorship at his clinic.
Yeah.
So and then he hired me when I graduated, that was a blessing. And after 6 weeks of being in training, he's like, Carolyn, go on your own. I'm like, no, I'm not comfortable. He said, I don't care if you're comfortable. You know what you're doing. You just need to build up your confidence.
Okay. Okay.
And that man just put me out there. And then before you know it, all of my credentialing was done with the insurance. And then he put me at a clinic all by myself. So, and I had patients, they were like, oh my God, thank you so much. We love the way you take care of us, you know, and you are so professional, you are this, you are that. And so after my contract was over with him,
Mhm. Mhm.
then of course, like I said earlier, our schedule was getting busy with medical mission, with ministry, with the children. We have two children in college, and then one in middle school and one in high school.
Mhm.
So somebody needed to be flexible. So I came home one day and I had a discussion with my husband. Well,
Mhm.
we've been talking about opening our own clinic or starting a business
Yeah.
one, you know, one day, but we didn't know it was going to be this quick.
Mhm.
So the 2013, actually, we started the process. In 2020, we were like, okay, let's open a group home. But then the application got stalled during the COVID and stuff. So when I got my experience as a nurse practitioner, I was like, you know what? I prayed about it and I felt really good within my spirit. And I
Mhm.
discussed it with my husband. And my husband was like, you know what? I was thinking the same thing.
Mm.
So let's go ahead and start. And that's how we started. And I've been out of work. I only work for myself. He's still working,
Okay.
but I only work for myself at the
Mhm.
practice,
Mhm.
and things have been really, really good. So I just give God all the praise for trusting us with this assignment, because I see it as an assignment for every patient that walk through my door. What if it's Liberian or white, Mexican? Because everybody comes now. I don't just see my community. Everybody
Mhm.
comes.
Mhm. Mhm. Mhm.
Oh,
What challenges do you know as a first time healthcare entrepreneur, right, as an entrepreneur in a healthcare profession? What challenges do you face as an entrepreneur?
so knowing what to do.
Mm.
There's so many challenges. You have to go through the application process. You can't just wake up today and say, "Oh, I'm starting a clinic." No, especially in the state of Texas. Oh my
Okay.
goodness. For you to even be approved,
Yeah.
that is a whole thing by itself. So, and thank God, like, 'cause again, my husband, he did all of the application. All I
Mm.
had to do is make all of the certificates and the licenses and everything that is required. Make sure it's available. Make sure it's active. So
Mhm.
he was on the phone with the people that he needed to be on the phone with for the application. What we needed to do. So sometimes there's one thing that we didn't complete on the application. They send it back to us. They say, oh, you have to do this one, you have to do that one. So the challenge is, especially when they know that, oh, at the time the application goes in, they don't know if this is an African person or if this is a Black person. And then, of
Okay.
course, my last name just, throw me out there. There's no Woahloe.
Okay. Okay. Yeah.
And then sometimes when they're talking to you on the phone, like, oh, okay, let's do this, let's do that. Before you know it, it's 30 days past, 45 days, and then you keep calling and calling. But at the end of the day, we got our application approved.
Mhm.
And then after the application is approved, you have to do like what you might call like some module, like like testing to make sure that you
Mhm.
know what you're doing.
Mhm.
And then you go to the state level, you go to the national level. You have to apply for insurance. Insurance takes about 3 months to 6 months, anything between 3 months to 6 months.
Mhm.
And so It doesn't come easy. It is not easy. It's not just the application process, but the money that goes into it. So when you starting a business, we had to tighten our belt um, to make sure, okay, 6 months, Carolyn is not going to go to the store or not going to sew any new African clothes, but
Okay.
that's not working.
Okay.
Oh,
Okay.
no, you just have to be disciplined. You have to network. And
Mhm.
then another challenge that I have before, because in Texas, you have to have a collaborative physician.
Yeah.
And everybody that I called, it was either 500 to it was between $500 to $800 a month just to
Hmm.
have a medical doctor to say, um, yes, before we can approve your application,
Yeah.
you have a doctor that would be your collaborative physician that is
Mhm.
required in Texas. So
Okay.
it took me about 4 to 5 months to
Wow.
figure it out.
Okay.
And
Okay.
then I was talking to my friend one day, Oretha. Um, she's like, "Well, why can't you? Charles will do it for you." I was like, "What you mean? Mind you, her husband is a doctor." He's
Hmm.
like, "She's like, Charles will do it for you." I was like, "Girl, stop." She said, "Yes. In matter of fact, I'll be a good girl and he will do it for you for free."
Oh, okay. What a nice friend, right? What a
Yes,
sister. She's not even a
yes,
friend or sister, I guess. Yeah.
yes. And at that time, her husband, he didn't have license in Texas.
Hmm.
So when she said it, I thought she was, joking and stuff. Before you know it, in less than an hour, her husband called me and he went on the Texas Medical Board and read everything that was required. In less than a week, this man got his license, he got his DEA. He said, "Carolyn, when are you going to start your practice?"
Wow.
I'm like, "Oh, wow." It took me 5 months to get a
Hmm.
collaborative physician.
Hmm.
And without that, my application wouldn't have gotten approved. So,
Wow, wow, that's good. That's good. Well, kudos to your friend, kudos to your friend for helping you out. Kudos to the husband, what I mean, is as you said, everywhere collaboration, teamwork. I think that's what you guys doing over there, right? And keep
yep.
all the good work. Folks, so now we are here with Miss Carolyn Woahloe, a health professional in the DFW area. She has her own practice, CaroMas healthcare, right? Is it CaroMas clinic or
CaroMas Healthcare Services.
CaroMas Healthcare Services? Thank you for that. So folks, you can contribute to the conversation tonight by putting a comment in the chat or calling our number 952-594-5154. But here's the thing though, right? I know you have talked about a lot tonight, how you have some mission back home, you have kids. How do you balance being a mother, being an entrepreneur, and doing all of, like, you are the vice board chair, what I mean, doing so many other things? How do you balance all of that? How do you balance it?
Well, you put God first. In
Mhm.
in 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 my household, one of our favorite Bible verses is putting God first.
Mhm.
Joshua 24:15. As for me and my house, we will serve the Lord. And
Mhm.
then Matthew 6:33. Seek God first, and everything will come running to you.
Okay.
Um, so how do I balance family and professional work? I'm
Yeah.
still working on that. I haven't gotten all set
Okay.
stone or anything. So don't whoever listening to me, don't think Carolyn got it all together. No, I still have my downtown. And my husband allowed me to have my me time.
Okay.
And my children allow me to have my me time. So sometimes when I keep going and going and going, he's like, "Honey, it's time to take a break. It's time to relax." And he would take the computer away from me. He would take everything from me and tells me, "You are not going to come downstairs today. You will stay in that bed. Whatever you need, we'll give it to you."
Okay.
So I have my me time. And the good thing about we both love what we do
Mm.
and we both are on the same page. So it makes it easier to do the things that I'm doing. With that support system, even though sometimes he say I don't listen to him, and sometimes he say I'm over the edge, but at the end of the day, he still supports. He
Mm.
still allow me to be me, to take my break when I need to.
Okay.
And then mind you, one of our children, they all play sports.
Mm.
So sometimes I'm running from work and going to the school to listen to somebody play the flute or somebody playing volleyball or basketball or track.
Wow.
We just kind of, schedule ourselves to where it's not overwhelming.
Hmm.
And when it gets overwhelming, when our son, he's old now, so he helped us with the driving. He takes his sister to other places that they need to go when he's not working or when he's not in school. So it really helped.
Okay.
Yeah, and we take vacation. We love to take vacation. We love to take vacation. My husband and I, we would travel with the children, if not in the country, out of the country, to
Hmm.
just take some time off. So,
Okay.
yep,
Okay.
that's
Okay.
that's how we de-stress and refresh, rejuvenate, and yeah.
That's good. That's good. That's good. That's good to hear. The other thing, though, right? You've been, you've been, as you said, you've been in business now for over a year. Where do you see where do you see CaroMas in the next 5 years? What does the future hold for CaroMas?
Expansion.
Okay.
Expansion in a sense, CaroMas getting her own building,
Mm-hmm.
um, opening another location in Dallas, because I'm in Fort Worth, opening another location in Dallas or Arlington,
Mm-hmm.
and hiring other practitioners and office staff to work. I want to be an employer.
Okay.
Yes, giving
Okay.
other people the opportunity to put food on their table.
Okay. Okay.
And of course, taking care of my patients, because that, like I said, that is my ministry. It's not a job. That is a ministry. This
Mm.
this this thing that we do is more than just getting a paycheck. And you know what's fulfilling when your patient tells you, "Thank you so much for giving me a warm towel to wash my face.
Mm.
Thank you so much for taking the time to explain to me what I didn't know."
Okay.
That right there is fulfilling. If I have one person in my office today to say, "I went to Carolyn and she did XYZ and she just sat with me." It's not about just giving medication, but just sitting with my patient so they can understand their health care, so they can
Yeah.
understand what's wrong with them. And then we, both of us, can work together to come up with a plan that is good for you.
Okay. Okay. As you know, right, the American healthcare system is very, 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 very complicated. A lot of folks, struggle to understand it. How do you help your patients navigate the system? I mean, the healthcare system here is very confusing for a lot of people. I mean, even even those that pay attention to it, right, it's just
Mhm.
complicated. There's co-pay, there's co-insurance, or I mean,
Yeah.
there's so many things, right? A lot of people don't understand the system, right? How do you help
Mhm.
patients navigate the system?
So sometimes my patients and I, we learn together. And again, I'm still learning, especially the insurance aspect. But
Okay.
the good thing is my husband has a business background
Hmm.
and also finance background. So he helps out with that. But I do use, I take advantage of the community resource that I have.
Okay.
Sometimes, the patient will be like, "I don't know, I have this insurance and I don't know what it pays for."
Hmm.
And sometimes I go in my community and talk to my seniors because I take care of that adult and gerontology population.
Okay.
So I have a lot of education podcast sometimes about the reason for primary care, some of the things that you need to look for, some of the screenings that you need to do, what
Mhm.
your insurance cover and what it doesn't cover. So I keep myself informed so that when my patient come, I'll be able to easily tell you, okay, this is what it is. And if I don't know it, I don't pretend like I know it. Sometimes
Mhm.
it'd be like, "Oh, I'm professional," or "Are you confident?" No, but when it comes to somebody health, you don't want to pretend. You want
Yeah.
to be able to be true to yourself and true to them, so they
Mhm.
can. I talk about the trust, the building trust, because if you
Yeah.
are true to them, they will trust you. They will want to come back to you. But if you just be like, oh, I'm the doctor, I'm the nurse practitioner, I know everything. They'll be like, mm-mm. Sometimes they don't want to come back. So to keep your patient very comfortable in a safe environment, in a trust environment, you have to continuously educate yourself to be up to date on the changes. Like today, I was reading on one of the insurance, one of my
Mm-hmm.
patients that I
Mm-hmm.
submitted the claim,
Mm-hmm.
and I was reading on there and said, "Oh, you cannot use this quote anymore." I didn't
Oh
know
wow.
that. Yeah,
Okay.
that quote was good
Yeah.
few days ago, but today it's not good anymore. You can't use it because they've changed it out, and I had to call to let him know. So keeping my patient informed is so important. That
Mm-hmm.
way, some of the sometimes and when I used to work at this place, sometimes I go to some doctor office, they have like 20, 30, 40 patients waiting for them. Like you
Mm-hmm.
don't have time to talk to everybody.
Yeah. Yeah.
The time that 5, 15 minutes is not enough. And that was one of the things that were behind me because I wanted to have that one-on-one, that personal, intimate relationship where
Mm-hmm.
my patient would not leave the office with question because if they don't understand it, they're gonna keep calling you. They're
Mm-hmm.
gonna keep coming.
Yeah. Yeah.
Yes, it's good for them to come, but you'll bill the insurance. But what good is that money when you keep, when it's something that you could have just taken 5 extra minutes to explain to your patient so they don't feel like they are just another number,
Okay.
you
Okay.
know?
Okay. I mean, it seems that then, what I'm gathering from you, right? You also provide educational resources, free educational resources to your patients and to the
Yeah.
community.
Yep.
Okay. 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 And how's the community receiving that though, right? I mean, the free educational resources, is that is the community very receptive to that? Are they responding positively to those kind of messages that you are providing to the community and to your patients?
I would say sometimes yes, sometimes no. I do a lot of that on Facebook, and then if I need to reach out to the community, like sometimes we host a community health fair.
Oh,
Sometimes,
that's
and
good.
we have other vendors, we have other hospital people come, we have insurance people come and talk to the community. Share a brochure or talk to them if they have any question and stuff. So
Mhm.
sometimes depending on the timing. Sometimes it's a good turnout, and sometimes, like I say, our community, when it comes to education, we have to keep saying it. Like I tell myself, if one person get the information, then I have completed my assignment.
Definitely, definitely. Yeah, right, right. Our community sometimes, as you mentioned earlier, right, there's so many drama out there. That's why our community gravitate towards. Folks like you, they don't gravitate towards you much because you're providing great service. You're providing great resources and things like that to the community. So kudos to you for doing that. Folks,
Well,
tonight we have Mrs. Carolyn Woahloe in the house. She has her own clinic in the DFW area in Texas. That's the first, right? It's the first time me hearing an
yeah.
immigrant or Liberian owning her own clinic. So when I saw that, I said, man, we got to bring her on the Inner Cycle podcast, right? To elevate, to amplify her story, to amplify her business, right? Because I think it's a great thing. I think hopefully all us can follow your footstep. You are doing good work, and like that's what we want to do here, like amplify folks like you, because sometimes there's so many drama out there, so many things out there that other people are gravitating towards. But the other thing I want to bring up though, right? The American healthcare system, I mean, there's rising costs, so expensive. How
Mhm.
do you help your patients? I mean, it's like insurance. Even sometimes when you have the difficulty sometimes we have as immigrants. Even if you have insurance, you go to the hospital. It's always they gotta pay, and then you wonder, okay, so what am I insurance for, right? That's the first thing sometimes you ask, okay, what am I insurance for? Is like, so how do you help your patients, understand, the cost of healthcare?
People say healthcare. And the last time I did a post on one of my friend posts, I was like, they should give all nursing or healthcare professionals free healthcare. And then she came back, she's like, that would not be possible. And I totally agree with her. Healthcare is not free. And then sometimes, like, in Liberia, like I said, we are heavily involved in Liberia,
Mm,
and I see some of the reason why our healthcare system is the way it is this notion of free healthcare. Healthcare is not free. And it's something you have to really understand that and make your patients to understand that even though you paying your insurance every month or every 2 weeks or what have you, you still have that copay. Not everybody has to make a copay depending on how much you pay on your premium. So what I would advise when that enrollment period comes, go talk to the person in the HR department or call the insurance company and ask them so they can give you the different options that you have. Because it's good to pay that low premium, to say, oh, you can only pay $200 every 2 weeks or every month. But guess what? At the end of the day, when you go see your doctor, you still have to pay your copay. Some insurance copay is at $5, depending on the type of plan that you have.
Okay.
So it's always good to call the insurance company, even if you don't have someone HR or whatever to reach out to. Call that number, call the insurance company, and allow them. Some of the reason why some people fall into this thing, they don't want to take the time to do their research. They just want people to feed it to them, and you see us getting into problem. Do you have PPO? Do you have HMO? Is your insurance in the marketplace? What are the different things or different information that you need to be aware of? Those, that little fine print that we never read. And then when you go to the doctor office, then you are hit with this high bill, especially go to the hospital. Some people go with the ambulance. That's a different fee for that. Just for the ambulance to come to your house, that's right up there, $1,000 or so. That's not including all the other treatment that they're going to give you. So we have to be we have to educate ourselves when it comes to the insurance. And before I see my patient, they send me their information. They send me the insurance. I run it through the billing company so they can tell me, okay, when this patient comes, they're going to pay X amount of copay. When this patient comes, they're not going to pay a copay. And I contract with the insurance company. So what happens when you contract with the insurance company? Insurance will say, okay, you agree to see our patients, but this is how much we're going to pay for you. This is how much we're going to pay you when you see our patient. The patient will be responsible for his or her copay. But on the other part, the work that you've done, we're going to pay you $120, $150. And you are agreeing to say, yes, I agree to take $120, excluding the copay. So those things, those conversations, I do have it with my patients. I'm like, okay, this is what your insurance is. This is how much your copay is going to be, and this is how much your visit is going to be. So there's an act, like a law that tell us healthcare practitioners we have to tell the patients how much it is that they're going to pay. If you don't do that, you're in trouble.
Yeah. So as a provider, then if I hear you correctly, you do have contract with with insurance companies. So are you like in network for some of the insurance companies in Texas there?
Oh yeah, I'm in network with Blue Cross Blue Shield of Texas,
Okay.
United Health,
Wow.
Medicare.
Okay. Man,
Uh,
you're doing it big. I mean,
oh
it's like
yeah, and then United Health UMR is also on. UMR is called United Medical Resources. It's another big company that is on the United Health. What else do we have? Gosh, I forgot what else I
no,
have. So I have,
you have. I think you know. You're you're doing it big,
oh
right?
yes, I have Aetna and I have Cigna. So United Health, Aetna, Cigna, Medicare, Blue Cross Blue Shield. Yes,
Okay. Okay.
and
For
more to
folks,
come.
for folks listening to you tonight, right, that are in Texas, like in the DFW area, how can they visit CaroMas?
So you can go online, www.caromashealthcareservices.com.
Okay.
You can call us 682-421-0298. Or you can come and visit our location at 817 Town Court, Saginaw, Texas 76179.
Okay. Okay. And
If
you
you
say yeah,
want,
in it.
just put Carolyn Woahloe in Google. Everything about Carolyn Woahloe will pop up.
Oh, wow. Okay. So Google already know you like that. That's good. You're doing it big. You're doing it big. I mean, if there's one thing, right? You have been in the healthcare system for a while now. If there's one thing you could change about American healthcare, one bold thing you could change about American healthcare, what would it be and why?
Affordable. Well, okay. So the one thing I know people, it's all about pushing medication, but just a healthy environment and the food that we eat. Most of our problems start with the food that we eat. If the FDA can regulate the food that we eat, help us to get more organic food, um, you know, um, don't have this particular community to have a better environment or better food, and then the other community don't have it.
Hmm.
So if we can make the FDA regulate or make sure we have food that are safe, less toxic, that will really help the healthcare system. And gosh, there's so many. I'm doing a class on healthcare policy, and
Okay. Well, let me not get you started in your book business, okay? Yeah, before you go off on me tonight. But to young immigrants listening to you tonight, to young folks listening to you, those who have come here, those who have just come here, those who have been here, say, gosh, I hear Caroline's story is very inspiring. She's doing great. Who dream of making a difference in their own communities. Right? What advice will you give to the young, to folks who are listening to you tonight who say, God, Caroline is doing great. I can't believe a Liberian immigrant establish your own clinic. What advice will you give to folks who want to venture into their own business or want to do something, but they're afraid?
and being a friend is good because that will help you to do it right.
Mm.
But it's doable. It's doable. Some people may not have the support system that I have,
Yeah.
but I know there are so many single people that are successful that have even gone ahead of me, you know.
Okay. Yeah. Folks, it's an inspiring story here tonight. Go ahead. Go ahead.
Um, so I'm sorry, my internet. So yeah, so if you are thinking about starting a business, have a plan. The word of God say that we should plan. When you plan, you will make it to succeed, right? Give
Mhm.
God something to work with, you
Okay.
know,
Mhm.
have a plan, have a goal. At first, that's where it first starts, and then you take it to God. And
Mhm.
don't do it because Carolyn is doing it. Do it because this is what you want to do. And also network, reach out. Like right now, I have some Liberian doctors, Dr. Stella, who opened her practice in Maryland. She
Oh
was one
wow.
of those people that I used to reach out to. Even every
Okay.
now and then I text her, hey, Dr. Stella, I have this patient or I have this question. Can you please help me? And then she will text me back or she will call me.
Okay.
So we do have so many Liberian nurse practitioners and doctors that have their own practice. The,
Okay.
the the thing with us is we don't like to reach out. We
Okay.
don't we don't want to ask somebody. It's
Okay.
okay to ask. If I don't
Mhm.
know the answer, trust me, I will find that answer and come back to you. So it's
Okay.
okay to ask and it's okay to make a plan because that's where, put your to-do list down. Do I know it all? Do I have everything together? No, I'm still learning. But you have to start from somewhere.
Okay. What kind of impact do you hope to have, in your community, and what kind of impact do you hope your clinic to have?
So I want a healthy community. I want a
Mm.
community where healthcare is affordable, is accessible, and more healthy. You know, what do I mean by that? I want our community to feel comfortable to go see their primary care provider,
Mhm.
you know, because most time we wait until things get to the emergency state,
Okay.
then it's too late. I want people to do the screenings that is required at the age that you are at. because it's better to know now and take care of it than to wait until we get to a stage 4, stage 5, and then there's nothing you can do about it. Then before you know it, you say RIP. No, I want a healthy community, not just physical health, mental health, spiritual health, emotional health, the holistic care. That's what I want to see in my community. Because when we are healthy, physically, mentally, we'll be more positive, we'll be more giving, we'll have more compassion, you know. So that's what I want to see.
What do you hope your legacy to be, right? Venturing into healthcare, establishing your own business, your own clinic. I mean, it's a big deal. What do you hope your legacy to be?
I want to let my children know that it's not too late, that you can do it. We are in this country, even if you are in Liberia, it's possible. Leaving a legacy for your children. And it's not about what I have when it comes to the humanitarian zeal that I have. It's not about how much Carolyn has, the big house that she lives in, the cars that she drives, and what have you. That's not. At the end of the day, is the impact that I've made on a life. That's what I want people to know me for. Like, yes, I went to CaroMas Healthcare Services, and she sat me down and treated me like a family,
Mhm.
and talked with me, not talk to me, talk with me about my care. I
Mhm.
want people to know that when they hear the name Carolyn or Thomas or CaroMas, what impact did I have on you? And I want that impact to be positive.
Wow, that's great. That's good. That's inspiring right there. As we wrap up here, right, it's a 1 hour show. It's been a good conversation. It's been nice talking to you. Learning a lot about you, your journey, and everything you're doing in the DFW area. There, I hope you can expand. As you said, Minnesota was the original home. Who knows, right? Maybe someday bring that clinic here.
Oh
you know.
no, I do. Actually, I do have a license in Minnesota. So for
Okay.
people that want to get on the medical weight loss and you are listening to me, you in Minnesota, you can call me. We can do telehealth. I can do telehealth with you from here. So if anyone is willing to, if you even want to talk to me about your health, if you feel comfortable, I'm open. If you want to talk to me about your lab, I'm open. You can call me. We can go over it. So I have licenses in Texas and Minnesota.
Yeah, that's good. That's good. As
Mhm.
we wrap up here, I know you got so much going on. But what does Caroline does for fun? I mean, what do you do for fun outside of work, outside of your clinic, outside of everything else? You got so much going on. What do you do for fun?
I love to look pretty and dressed.
Okay,
No,
okay.
for fun, I love to travel. I love to spend time with my husband. Um, I just and travel. I love to give him a hard time. I like that.
He's a best friend. That's how it seems like. Well, you guys are best friends. The best body. That's good. That's
Yes.
good. But as we wrap up here, what's the message you want to leave with the folks that have been listening to us for the last 1 hour? What's the message you want to give to folks out there who have been listening to us for the last 1 hour and who are going to listen to this podcast later on?
Well, I want to say thank you for having me. It's an honor to be on the Inner Circle podcast. Another Liberian doing something great, amplifying the positive in our community. I think that's the best thing we can do because, like I said, so many of us are doing great things, but we are not amplifying those great things enough.
Yeah.
So thank you for starting this podcast, and to all of your team, I want to say thank you for having me. What I would like to leave with my audience is, do not limit yourself,
Mm,
because for a while, for a long time, I limited myself. I didn't see the value in myself. I didn't think that I was capable,
mm.
but it took God and it took my husband to see that value in me and
Wow.
to trust me enough with the things that I'm doing. And to all of my patients that trust me with their care, I'm so honored and I'm so grateful to that, to them for that. But to that mother, that brother, that sister that is listening, it is not too late. Yes, there are bumps on the road. The word of God said, even though we walk through the valley of the shadow of death, you are walking through, you are not staying there. You have to rise up. You have
Yeah.
to move. You know, you can go and take student loan if you want to go to school. It's okay to do that. There are grants and scholarships. Once upon a time, I got grants and scholarships to go to school. And I told myself, if I continue, if the financial is going to continue to approve me for these loans or these scholarships and stuff, then I might as well just continue my education. And that's what I did. Coming from a country where I didn't have the opportunity that I have now in this country, take every, you know, make every use of it. Make the time, because don't say I'm going to find time. You will never find that time. You have to make the time. You have to prioritize what's best for you, for your family. And then at the end of the day, your blessing is because it's for somebody else.
Yeah.
You know, when you're in traffic, if you don't move, the car behind you would not move. So someone is depending on me, Carolyn, to move so they can move. Someone is depending on Carolyn to be blessed so they can be blessed.
Wow.
So that is my encouragement to anyone that is listening. How did she do it? It wasn't easy.
Yeah.
But you need to look for that one step. Take that one step and look for that one person that will believe in you. First, you have to believe in yourself, and then somebody will believe in you, and they will help you to hold your hands to carry on. So again, thank you so much. I love to be here. I would talk all day, all night about healthcare. If you
Yeah,
don't think
man,
about
you know,
it.
definitely. No, we got to bring you back here, you know, because you're very inspirational. You know, I mean, your message is very inspirational. So, is that thank you so much though, for joining us tonight. It's been a great time having you on the Inner Circle podcast. We appreciate you accepting our invitation, and we hope you can make this your home, right? So we can continue to amplify your voice, you know, your practice, and the things you are doing for our community in the DFW. In the DFW area and the larger Liberian community. So thank you so much, and we hope to be in touch. Folks, that's the end of our show tonight. Thank you so much. We'll see you back here tomorrow at 7:30.
Lift every voice. So join the conversation. Let's set the tone. In a circle podcast where love is well.